They sure do, Reed. Good evening. Good to see you, Las Vegas. Good to see you, too. Context is very important here. This increase has been expected. The question is, when will it peak? One educated guess comes from the respected Institute for Health Metrics and Evaluation at the University of Washington State. The White House and health officials around the country follow its conclusions. The institute says Nevada's daily death rate will accelerate in mid-April and hit a peak of 31 deaths per day on April 20th. It also estimates our total number of deaths will peak June 1st at 921. The university did not return my call for comment.
I would treat everything as having a lot of uncertainty to it.
But Brian Labus with UNLV's School of Public Health says take those estimates with a grain of salt.
You can't use it to say this is what's going to happen on a particular day and expect the outbreak to match that exactly.
Labus says there are many variables that could change those estimates.
Well, one of the biggest ones is how well we are socially distancing ourselves.
The better we social distance, experts say, the more we blunt any wave of patients that could hit a hospital. On March 17th, the governor asked Nevadans to stay home. Today, he ordered it and extended closings until April 30th. The latest death toll in Clark County now stands at 28. The number of confirmed cases sits at 961. And Dr. Whit Kreschauer with the Southern Nevada Health District says the case count does not reflect how infected we actually are.
The incubation period for this disease is up to 14 days. So the cases we're seeing now are really a reflection of up to 14 days ago.
What that means is today, April 1st, more people than that are infected. And while the elderly and those with health issues are most at risk, the biggest single age group with cases in Clark County remains between 25 and 49.
We are seeing cases of younger people who are dying as well as people who, maybe middle-aged and don't have any chronic medical conditions. So this is definitely something that I want everyone to be concerned about.
Today, the board unanimously approved emergency funding for a new shelter that'll actually be built right here at the main campus that'll have 40 beds to treat and house those who are testing positive for the coronavirus. This meeting actually held through phone conference earlier today, and here's what we learned. According to the board, the facility will serve those who have tested positive for the coronavirus and need to be in isolation, but may not have an isolated area to go to. That could include homeless individuals or people in nursing homes. It'll also serve those who have been released from the hospital but still need to be monitored. Now, the board is estimating this will cost around $3 million. Members of the board explained the urgency to build a new shelter ahead of the peak of cases here in Nevada, which they believe could happen sooner than we think.
And currently, what FEMA is quoting us is $140,000 a bed if they were to come in and make a makeshift facility. And then they just build it, leave it, and then we also have to pay for the dollars to put it back into where we started. Dr. Nemec, you're right. We're looking at physical facilities. We're looking at different facilities as a whole. And we anticipate in the next 5 to 7 days that we'll have everything locked down so that we as a community can feel comfortable that we have all the resources that we need.
Now, let me break down the funding for you really quick. $3 million is what it's costing, or what they're estimating it's going to cost. According to the board, FEMA is going to reimburse 75% of that, but that still leaves about $750,000 to $800,000 that the health district will have to come up with. Faye Jesse reporting, News 3.
I'm the coronavirus, but you can call me COVID-19.
A little bit of foil and knowledge for these two Griffith Elementary 5th graders.
I'm going to destroy you and I'm going to keep you home.
Schools are closed, but there's still learning to be done.
I'm doing homework online.
This student video, a creative way of using learning to combat the coronavirus.
Wash my hands, covering My car.
We know that our hard times, we know that we need to keep learning, and I'm making sure that they are getting their homework done.
Their mother, Miriam Mesa, says she's still working full-time as a medical professional, but she and her husband got their 2 students on a routine, following instructions given by teachers online through Google Classroom.
By week, they assign every day a special homework to do, and then the teacher will contact us sometimes on FaceTime on Google Class, and so they can keep in touch with the students.
In a notification to parents and staff today, Clark County Superintendent Jesus Jara says the district is working to fix connectivity issues for as many as 60% of CCSD students who don't have internet access. Mesa says when her kids aren't online, staff at Griffith Elementary make sure they have learning packets available.
I really need to thank the teachers, because now until we see it in personal, like parents, how hard it is to the kids to be progressing at school with the homework and every class. My respect, they're doing a great job.
Mesa believes moving forward, parents and students will learn to adjust, all while staying positive.
It's going to be sometimes some hard times there, but we will go through it.
Anxiety is on the rise as many resources used to strengthen mental health are closed. News 3's Alexis Gorey shares how the Vegas Strong Resiliency Center is stepping in to navigate through trying times.
The director for the Vegas Strong Resiliency Center says it's okay to not have life figured out right now, but the center is available to lend a helping hand. The Las Vegas Strip dark, many out of jobs, all due to coronavirus.
The current situation, there's a lot of anxiety there. This puts a lot of pressure on families and individuals in trying to navigate this, taking them out of their schedules, taking them out of their comfort zones.
Tanel Pereira, director of the Vegas Strong Resiliency Center, says call volume has gone up 20% during this pandemic, and she expects that number to rise. The biggest request so far, financial assistance.
Kind of shelter in place in our homes right now, and the fear of being evicted because somebody's lost their job and they can't pay their rent.
Pereira says the center has been providing more outreach and resources to guide people through not only things like rent, mortgage, and student loan assistance, but also putting mental health first.
This situation can put added stress on personal relationships within the home.
Their website even has a COVID-19 resource tab with helpful hints.
You know, step away, count to 10. We also have some general coping skills, some online try yoga, some meditation links. I encourage everyone to take a moment and kind of gather their thoughts themselves, take care of themselves.
The tab specific for mental health resources and the coronavirus is on the center's website. We have that link on news3lv.com. In Las Vegas, Alexis Gorey, News 3.